A St. Joseph family felt forced to surrender custody of their 14-year-old son to Children's Division due to lack of mental health resources. News Press Now's Jenna Wilson has the story in a News Press Now special report.
He's been rejected by 2 foster families because of his behaviors.
They are frustrated parents.
I made the decision to, what I thought originally was what they told me was temporarily sign my rights to the state so that he could get the mental help that he needs.
So desperate to get their child affordable mental health treatment, they faced the gut-wrenching decision to give up custody for care. The 14-year-old boy's parents have pointed to a lack of services, which they said has only made his behavior worse since entering the system more than 6 months ago.
They still haven't even found a placement. He is currently sleeping on CPS office floor during the week.
This is a battle the family has been facing the last 4 years. They started noticing behavioral changes when the boy was 10 years old, after he came back from a stay with out-of-state relatives. In an attempt to get help, the juvenile has experienced 7 short-term stays at local facilities within the past 5 years, moving between group homes and treatment centers such as Voices of Courage, The Center, and Mosaic.
I've never seen this outside of residential care. I don't know how it got like this. It should never have happened, was the therapist's words.
Still, with each visit, his behavior continued to decline.
Northwest Health, after a few months, threw their hands up in the air, said, "We are not qualified to treat this child, take him to family guidance."
The family says Family Guidance Center is one of the last facilities they utilized, hoping to get their son the proper mental health treatment. When they arrived, they said healthcare workers were flooded with hundreds of his mental health documents like this one before deciding they could no longer service him.
If we ever have a kiddo where we have kind of maximized services, or we have gotten to a point where we're having a lot of crisis situations with those kiddos, that's when we would help the family with a crisis screening, or they would be able to utilize our behavioral health unit as well.
Around-the-clock care is what the family wants their son to receive until his mental state is better. But unfortunately, that is not an option for anyone under 18 right now, according to healthcare professionals at Mosaic.
Unfortunately, we don't have an inpatient unit here in Mosaic, but there are some very good hospitals nearby that we do refer them to once they come to our emergency room, and we feel that, the outpatient level of care is not enough for them.
And the treatment they're seeking can't be found in the area and can't be provided for families of a certain income level. But despite hitting a brick wall with each treatment center, the family says they're not giving up.
We want to see him be able to succeed. I tell all of my kids they're better than me. I want to see them grow up. They can do anything.
You can read the complete story on the family's fight for care on our website at newspressnow.com. Reporting for News Press Now, I'm Jenna Wilson.